Hi, everybody. For those of you joining, we're just going to give it a few more minutes to till we get to the noontime hour Eastern, and then we'll start the webinar. I will say we just started to have a pretty big thunderstorm here outside of Boston, so hopefully I will not lose electricity. Welcome to those of you just joining. We're giving it about another minute before we get started. Welcome, everyone. For those of you just joining, we are just giving it another few seconds, and then we'll get ready to start. All right, well, it looks to me like it's 12 o'clock, so I'm going to get started. So welcome, everyone, to AMET Skin Cancer's webinar series, Skin Cancer and You. I'm Krista Rubin, a nurse practitioner in cutaneous oncology at the Mass General Cancer Center in Boston. Through this webinar series, I'm pleased to bring you a wealth of information on various aspects of cancer treatment, management, and emotional well-being. Today, we have a very special guest, Dionne Detraz, joining us from her home in France to discuss optimizing nutrition during cancer treatment. Please welcome Dionne, a registered dietitian nutritionist, interactive cancer dietitian, and author of The Cancer Diet Cookbook, Comforting Recipes for Treatment and Recovery. Dionne, welcome.
Thank you. I'm so happy to be here.
We're happy to have you as well. And for those of you watching, if you have questions, please feel free to submit them through the chat function. And for those of you watching us on Facebook or YouTube, you can just leave a comment and that will be submitted to us through the Q&A. So Dionne, again, thank you. Welcome. I want to start with, tell me about what exactly is an interactive cancer dietitian.
Yes. Well, actually, it's an integrative cancer dietitian. So
I'm sorry.
It's totally okay. I mean, we interact too, right? So that's that's appropriate. Yeah. Yeah. So integrative medicine, if this is not new for you, for any of you who are listening, basically the way I like to think of integrative medicine is it's combining the best of all evidence-informed approaches to help you heal, like your body, your mind, your spirit, right? So we're really thinking of it in a truly holistic way. And another way you can think about it is bringing together three aspects of medicine. So there's complementary medicine, right? There's like the kind of Western treatment approach. And then there's complementary or natural therapies that might be helpful. And then there's also self-care practices, just like how are you nourishing and taking care of yourself on a day-to-day basis. And it's this blending of all three that we see, that research shows us anyway, that patients do the best. They have the best clinical outcomes, and they tend to have a better experience overall across, any disease that you might be facing. So from a dietetics perspective, I mean, diet obviously falls into this sort of self-care practices, but I'm really trying to bring in sort of all those other holistic strategies that will complement your treatment and help you have the best experience possible.
I love that. It really is a nice way to provide comprehensive care and for patients to receive and have a comprehensive outlook on themselves. So that's nice. So how did you get into this? This is a very niche area. So
I
I'd
know it
love
is.
to hear.
Right. Yeah, I mean, it was a little bit of a winding path, as you could probably imagine. Probably most of us have that story of how we landed into our careers. But it started for me first in the world of science. I got my degree in human physiology. I thought I was going to study medicine, like it was kind of very traditional path. And then I got introduced to the world of holistic medicine and did some advanced training in holistic nutrition and herbal medicines and got really excited about that. And then I sort of veered back towards dietetics and I did training in dietetics. And then actually during my internship, when I was becoming a dietitian, I had the honor of working at MD Anderson Cancer Center. And that was this really beautiful experience of blending the two worlds, where I got to use this sort of medical nutrition therapy, dietetics lens. And I got to rotate in their integrative medicine department. And it was just this really beautiful aha moment of how the two worlds could come together and really help patients. So when I started working, I had this, I already kind of had this love of wanting to blend the two. And then that was when my father got diagnosed with cancer. So then, of course, when you have a personal experience, it was really my opportunity to put it to use, to put it to practice, to put it to the test, so to speak. And I was a believer, right? Like the whole thing worked so well that was where I landed. And through the years, I got to work in the hospital. I got to work at UCSF Osher Center, which is an integrative medicine clinic. And then when we decided to move to France, I started an online practice and just sort of continued this work of blending the two worlds.
Wow. Thanks for sharing that. What a path, but what an experience. Sounds like you've just had, you've been exposed to and you've really sought out different experiences that I'm sure help you and were able to help your dad through his journey.
Yeah. Yeah, for sure.
All right. So on that note, let's talk a little bit about the importance or kind of the whole aspect of nutrition in individuals with cancer.
Yeah, right. Well, and I know like something that we were considering before too is I feel like there's a lot of information out. Well, I shouldn't say a lot. I don't want to assume. From my perspective, it seems like there's more information out there about how diet can be important in cancer prevention, right? But maybe not always during treatment. Like sometimes I think that gets diminished as maybe not the priority when you're moving through treatment. And that's really where obviously I have a passion for that because this is my work that I do. So I've spent a lot of time thinking about it, but nutrition absolutely plays a role in active cancer. It's a really important role, actually. And I like to explain it as kind of a two-folded prong, so to speak. So the first is that when you're dealing with something like cancer and treatment, right, your body requires a lot of nutrients to heal, to repair, to rebuild tissues and cells, right? To keep your immunes, to have like a healthy immune response, to make energy, or even just to maintain your strength and your like muscle integrity. So many aspects that we kind of take for granted, I think, and maybe in a healthy body, that we don't realize how much nutrition plays a role in all of those things happening. So now you're trying to, help your body heal from cancer, to support treatment. And now you need those nutrients even more. And unfortunately, right, it's a bit tricky because a lot of times the side effects of treatment don't make like you don't want to eat. You're not as hungry. You might be nauseous. Things don't taste good anymore. So there is a very high level of nutrient deficiency when we're working with people moving through cancer. And so, yeah, so important. If we can keep your nutrition at the top of its game, you're not only going to have more energy as you move through treatment, but you're also going to heal and recover quicker, right? On the other end of it, which of course everybody wants. So that's really the first thing. And then the second thing is we also have really good research that certain foods that are rich in, specific phytonutrients can actually help the body target cancer cells, not just prevent, but also help us do things like trigger apoptosis, right? Like the death of the cancer cell, or help to inhibit the growth of cancer or inhibit the spread of cancer, like things that are really important when you're trying to heal, right? And not have the cancer continue to grow. So highlighting those foods can actually be somewhat medicinal as you're moving through treatment. And those are things like cruciferous vegetables are sort of like top of the chart, right? So things like broccoli and cauliflower and kale and cabbage, like this category of vegetables have a lot of these nutrients in them. Then also foods, the alliums category, so garlic and onions and leeks, if you can tolerate them during treatment, that is also going to have some anti-cancer benefit. And then also, what other foods like berries or mushrooms or even certain spices, right? You've probably seen some of the information around things like turmeric or ginger or cinnamon, right? Like really helping the body heal, or even beverages like green tea. So my approach is really like both, like, can we make sure enough nutrients are coming in so that you can heal and repair and have good energy? And can we highlight some of these nutrients that will give you more medicinal value?
Yeah, you bring up so many great points. I don't even know where to start.
Yeah, okay.
I think what would be helpful is, I'm just gonna take a little bit of step
Sure.
back for a moment. So one of the questions I get from so many patients is, or one of the discussion points is they're newly diagnosed with cancer. This is kind of a shock to the system. They're trying to process this. Family members are trying to process this. And now they want to get healthy. They want to do everything they can to be successful in treatment. So for many people, it's like they have these thoughts of having this dramatic transformation. And so they may just, abruptly and dramatically change their diet. They may start an exercise plan if they haven't been exercising in a little while. And that's where I kind of say, all right, let's take a time out. Too much at once is generally kind of setting you up for not being successful. So my question to you is, where is a good place to start? If you do want to start considering what you talked about, getting those healthy fruits and vegetables and thinking about nutrition, where's a good place to start?
Yeah, that's such a great question. Because you're so right. I mean, of course, like motivation is super high. Like if, if there was ever a time to feel motivated to overhaul your diet and lifestyle, it's now. So of course you want to do everything you can to help your body heal. But it's a good point. It can be really overwhelming, especially when you're also now managing treatment and whatever that might mean for you, and whatever side effects that might mean for you, right? So I would before I answer like the diet specific place to start, I would even just go back a step further and say, again, like as an integrative approach, is I would encourage you to just choose even like one thing, like what's your intuition, what's your heart really like guiding you to do? And maybe it's just like start walking more, or maybe it's to drink more water, or maybe it's to, take a walk in the woods, like get out in nature more, or whatever it is. Like it could even just be like the one thing that could make a really big difference, because the truth is, of course, your food matters, but so does your stress, right? So does your sleep. So does even just like your emotional support, your community. So when you think about like, what can I do to become healthier or to get healthy? I would start with like, where's your heart guiding you? Like, what is your intuition telling you to do? And just start there and see how that feels, right? And if your intuition is like, I really need to change my diet because like, I know I haven't been paying attention to that, right? Or it's gotten a little loose. That was a really common one after COVID, right? Like I felt like a lot of times the patients I met with after COVID was just like, oh my God, I totally like let loose during COVID. So now I gotta like rein it back in again, right? I don't think that was unusual for a lot of people. So here's what I would encourage you to do. Is because we talked about the fact that your body needs a lot of nutrients, right? Which can also maybe feel a little bit overwhelming at first, is I would just start with this simple trade out of like, can I choose more real whole foods versus processed stuff? and not even like label things as I need to like cut out this, and this. It's like, can I just start to bring in more of the good stuff? Can I focus more on trying to get some veggies in, whatever sounds good to me, right? Or some protein in, or just like real food, fruit, whatever sounds good. Like, can I start to fill my body with that? Because all of those foods have some of those nutrients that we're talking about, right? And as you start bringing in those foods, you're going to naturally start doing less of the other stuff, like less of the processed or less of the sugar or less of the fried foods. It might not even have to be something we're like consciously cutting out. Do you know what I mean?
That's good advice. Right.
Yeah, I think just start simple like that.
So we actually have a couple of good questions that I'm going to start kind of along those lines. So Joel asks us to quantify the amount to eat and nutritional values. I presume like how much do I need to be eating, or and what are kind of the values the nutritional values of the food that you are eating, that I would presume, Joel, and I hope I'm not speaking for you, is necessary during cancer treatment.
Right. Yeah. So that is a great question. And it's also going to be pretty individual, right? It's going to depend a lot on your body type, like your state of health coming into cancer treatment, versus like if you're really robust and healthy versus you were already maybe a little bit weak or malnourished. So there's kind of a lot of pieces that might adjust the goal amounts. But there are like some general goals that you could start with. And one of those is really around protein. Because when we think about the nutrients that your body needs to start like repairing and rebuilding, or even like creating blood cells and creating immune cells, you need protein for all of that. You need amino acids. So that is kind of an easier place to start, right? And I would say for most people, it's going to vary a bit, but let's say for women versus men, we can kind of average. So for women, that's going to be ideally maybe about 25 to 30 grams of protein per meal, ideally. So if you're able to do still 3 meals a day, let's say you're shooting for at least 25 grams, it's going to be maybe 75 grams of protein a day. That would be like a good place to start. And then you could refine it if you needed to, right? Based on your own personal needs. And then for men, that's going to be a little bit higher. So it's going to be maybe somewhere between 30, 35, 40, just depending on how tall you are, how active you are. There's so many elements there, but at least it gives you kind of a ballpark, right? And so if you're really thinking about each meal as making sure first I hit my protein goal or get as close as I can to my protein goal, and then bringing in, filling my plate with some colorful veggies, and maybe some of those veggies I just mentioned, like some cruciferous or some berries. I wouldn't worry too much about like the actual grams or the amounts of the plants. It's just like you're kind of complementing the protein with these colorful plants. You're going to get really close to your needs from there. So I hope that's helpful. It's a little bit tricky to give you an exact because it's so different for everybody.
So a question right along those lines. So a question is that I read a body can only take in about 20 to 25 grams of protein per meal. Does that mean I need to eat more meals to get the total protein in?
That's a great question. So again, that's going to vary a bit per person. I would say though, even if you could do 25 grams a meal, like if you could get to 75 grams a day, that's going to be really great. I mean, I don't know about you, Krista, but I feel like a lot of the people I see, like that is hard to do.
It's very hard to do.
Yeah, particularly if you're just like not hungry and so I'd say if you can just do that, that would be wonderful. And then it's okay you could certainly, it depends on the protein and how well you're digesting, but you can do more than that. You can absorb more than that at a time. We just need to make sure that you're digesting it well, which again is a little bit tricky during treatment.
It may vary at different points of your treatment journey.
100%. Yeah. 100%. Yeah.
And someone asked whether eating meat is beneficial or harmful.
Yeah. So this is a very controversial question. I will first just preface it with that, right? There's like a lot of opinions around this question. I actually think that meat can be very helpful, especially during treatment, because it's such a high quality, like nutrient dense protein source. So even if you're not able to eat a very big portion, you're going to get a good amount of protein, minerals, iron, like a lot of things that your body needs during treatment, right? Especially if your blood counts are low. I mean, there's so many reasons meat could be really helpful. The caveat, though, is the quality of the meat that you're choosing. And that's where the research around animal protein and cancer gets really like muddy, because the research that shows that it might be harmful is not differentiating the type of protein. It's not differentiating like the quality, so there's a difference between, like a hamburger from, let's say McDonald's versus like grass-fed, regenerative steak that you bought at the store. Those are not the same foods. So I think that is the caveat, that we have to be really mindful of the quality of the meats that we're eating.
And so Will asks, what about good plant-based alternatives to meat protein? Which is a great question, particularly in the setting of, more and more people are choosing to eat less meat.
Right. So this is a good question, and it is a little bit complicated. It doesn't mean you can't find good sources, but when you replace, so when we do some plant-based proteins, they are very healthy for you, but they are not as dense in protein. So it just requires you, this is kind of what I tell my clients, is that it requires you to be a little bit more intentional about how much you're eating of them, and then also how you layer in different sources of protein. So for example, if you were doing beans or lentils or soy foods, or nuts and seeds, some of the plant-based protein options, you usually can't just pick one thing and have it be enough. Like you're going to have to combine some beans with some nuts or some seeds, or you have to kind of layer it to make sure you get enough in. Soy is actually a really great organic whole soy food. So like the real, tofu, tempeh, edamame, like the real soy food is actually a really great option, because out of all your plant options, it is the most concentrated in protein. So it's going to get you closer to like what a meat equivalent might be. Like, just to give you an example, 1 cup of tempeh has 30 grams of protein. I mean, that's a lot, right? Like there's a lot of fish doesn't have that much in 1 cup. So I think you can make those substitutes. It just requires you to be a little bit more intentional. And then some of the processed soy alternatives, I am just not a big fan of. I think that we just don't know the long-term consequences of processed soy. We do, or processed meats. We do know that organic whole soy can be really helpful, can be good.
So we're getting some great questions, fast and furious
Awesome.
here.
Great.
So Sophia asks, along the lines of protein, which I think this is a good question.
It's an important
protein through such like nutrition drinks, for example, Boost or Ensure. And this is, I appreciate Sophia asking this question, because I think with my limited knowledge of, excellent nutrition, I'm kind of regularly recommending for patients that have a low appetite or just not a lot of energy. We talk a lot about protein, and sometimes they just don't have enough energy to make a meal or go shopping. And to be honest, these natural healthy foods can be expensive. So sometimes it's simplest to grab a can of Boost or Ensure or any of those products and drink them. So what, from your perspective, are those just as healthy? I know you talked a little bit about this with the quality, but where would you put the quality for these?
No, it's a super practical question, because I know that that's often, like, having a liquid supplement is often very helpful. So liquid protein options can 100% be in the mix. I think that even with my dad, that was really helpful at getting him through his first bout of chemo. But there are some serious quality concerns. So like the traditional Ensure boosts, I am not a big fan of. They are like, the first ingredient is corn syrup and sugar. Like, I just don't think that's helping you heal. Yes, it's giving you protein and it's giving you some vitamins and minerals, but like, it's also bringing in a bunch of ingredients that could be harming you while you're trying to heal. But there are other alternatives, and you could also make your own drinks. So one of the things I often encourage people to do is just have a good quality protein powder, on hand, and you literally could just mix that into water or mix that into milk or soy milk or, you know, and just drink that. And you're still going to get the protein that you need. Or if you had the energy and you wanted to make it a little bit fancy, you could turn it into a smoothie, right? We could put some veggies or fruits or other things in it to like beef up the nutrition of it. In my cookbook, I have several smoothie like options like this using protein powder, knowing that sometimes that is the best option for you. But I think we have to be really careful because they're not all created the same. And I'm happy. I don't know, Krista, if there's a way afterwards that you're going to be like distributing notes or links or anything, but I'm happy to give you like a list too of some of the sort of the more healthier drinks that I typically recommend versus the standard.
You could post that on the site. Yeah.
Okay.
I think the guidance. Yeah.
Yeah.
That would be terrific.
I'd be happy to do. I'll make a note so I don't forget.
So I'm trying to filter through all these amazing questions. One great question from Roy is, does nutrition vary for patients receiving immunotherapy versus chemotherapy? And that's a great question.
Yeah, it is a great question. I would say the basics don't change, right? I think in some ways, because, and I don't want to speak to all immunotherapies, but in many ways they're better tolerated for many clients or patients than chemotherapy. Sometimes that makes it a little bit easier to meet our nutrition goals, right? Like we have a little more options around meeting it. But some of the basics are still going to be in play because, you know, we're still going to need some extra nutrient needs to help the body heal and recover. We're still going to need some of those foods to help, even if it's just to kind of keep cancer away, right? If it's like keeping things stable, we want some of those foods in place to help with that, to kind of help with the prevention piece as well. The amounts may be different, right? You may not need as much as somebody who's maybe a bit more compromised with their treatment plan. So you're correct in that it's not going to be maybe exactly the same, but I would say some of the foundational pieces like the colorful plants or the protein, that's going to be pretty close regardless.
Great. So I'm just filtering through these a little bit more.
I love that there's so many questions.
I know this is such a hot topic. I mean, people have so many questions, and to be honest, as a provider, this is not something that we really are expert or even close to that in, because so much of our time is spent on addressing the treatment and the side effects. So sadly, this often falls to the wayside, and it really shouldn't. And maybe this is a good time to ask this question, but I presume that your thoughts about patients having consultation with their oncology nutritionist is something that you would recommend. Is it fair to say?
Yes, 100%. I mean, I wish it was just like standard, you know what I mean? You get your diagnosis, you're going to meet with this person, and this person. And like one of those people are the dietitian, 100%. Because I also think that, and it doesn't mean that at any point in the journey, bringing in some of these strategies will be helpful always. But if it's like right at the beginning, right, and we really like lay out the groundwork, it can make a really big difference in how you move through the experience. So yes, if you have access to a dietitian at your clinic or your hospital, please ask for a referral. Yeah,
I think it's a great point. We tend to do that more so when there's weight loss, unintentional weight loss.
Right.
But that doesn't happen to everybody. And many people do a good job of maintaining weight, but the quality, as you alluded to earlier, of what their intake is may not be as ideal.
Yeah.
So we're getting down to the hour here, the half an hour here. So I'm going to try to answer a few more. So another question is, selenium-rich diets may reduce the risk of melanoma and support survivorship. Any thoughts about that, or anything you share with us?
And it's so easy to meet your selenium needs. You just need Brazil nuts. And you really only need like a couple a day.
Interesting. And what's the benefit of the selenium? I mean, we know for specific cancers, but in a general sense.
Right. Oh yeah. No, in general, it's a really great antioxidant. So if we kind of go back to, I mean, that could be a whole nother topic. So I won't go far down that road. But when we think about some of the causes of cancer, like what actually causes a cell to become cancerous, you know, a lot of it is because of a mutation that is triggered by oxidation. And there's a lot of things that cause oxidation, right? In our environment and our lifestyle, so many things. But having a lot of antioxidants on board can buffer that, can kind of stop it before it becomes something, becomes an issue. And selenium is a really great, antioxidant tool for that purpose. And like I said, it's a bit tricky because it has become deficient in our diet because it's just not naturally in the soil as much as it used to be, but it is still very high in Brazil nuts. And you really only need 2 nuts a day. It's like,
I'm
you can do it. Down. You can get it done. Yeah.
All right. So a couple more as we're probably going to have to invite you back again.
I'm happy to come back. Yeah, we could do round 2.
And there's such great questions. So
good. We'll save them and we'll tackle them in another webinar.
Definitely. So another good question from Roy. Is there any evidence to the keto diet being beneficial?
Yes. So yes, there is. There is good evidence that keto diet can be helpful in certain cancers, but we're also seeing that it seems like as they do more research, we're seeing it be helpful with more and more cancers. So, we could kind of see across the board, it might be helpful. But of course, as with most things with diet, there's always a bit of a caveat. 2 caveats for me. So I don't just routinely tell everybody to do keto, just like I don't routinely tell everybody to do vegan, right? Because there's also that proponent. But I find that there's 2 things at play here, is that cancer cells typically are pretty adaptable. So yes, a lot of them are fueled by glucose. We do need to be really mindful of that and make sure we're not overdoing it. But if you cut out all glucose and you do fat and protein instead, sometimes they can adapt to that and they start using that as fuel. So it's not always the answer. For me, I like to keep mixing it up. I like to do something in the middle and then maybe an occasional fast or occasional keto or things to kind of keep the body guessing. And in many ways that seems to work better.
Amazing. All right. I'm going to have one last question. I hope that's okay. I'm going to go over because
of course, no, it's fine for me.
Huge topic, but, and we might have to do another webinar on this alone.
Okay.
But, so it has to do with gut microbiome.
Yeah.
So gut microbiome is related to immunotherapy being more effective, it said. Are there any specific foods that can be added to improve gut health? We're going to have to keep this short, but
yes,
short and sweet advice.
Yes, short and sweet. Question. We all need it too. Just by the way, pretty much everybody in the Western world has imbalanced gut microbiome. So just across the board, we could all use this information. We need the microbes in the gut need fiber to replicate and grow and flourish. So you definitely need to be eating a lot of plants, a lot of colorful plants. The polyphenols that's in the color help fuel this reproduction. Mushrooms also, great gut food, right? So we need a lot of colorful plants, and we actually need some foods too that have active cultures in them, right? So having things like yogurt or sauerkraut or kefir or raw pickles, having some foods with active cultures is going to help you repopulate. And the final thing I'll say with this is a big part of our microbiome being off, besides kind of some of the things we're eating or drinking that are disrupting it, is also just our not being exposed to microbes. So get in the garden, touch the dirt, hug your animals, actually expose yourself to microbes. This, believe it or not, improves the health of your gut as well.
Wow, fascinating. Thank you so much, Dionne, for sharing your valuable insights. I wish we could keep talking, but
I can come back.
Be respectful of time, but I'm going to invite you back.
Please
and thanks to our audience. Don't forget to share this episode with friends and family who might benefit from learning more about nutrition and cancer. And in our next webinar, September 18th, we'll be talking to Dr. Jamie Jacobs, who's the program director at the Center for Psychiatric Oncology and Behavioral Sciences at Mass General in Boston, a colleague. And we're going to talk about balancing life and caregivers. Just check our website at aimetskincancer.com for more details. Until then, stay healthy and stay informed, everyone. And thank you again, Dionne. So appreciate all of your wealth of knowledge.
My pleasure. Thank you for having me.
Okay. Bye, everybody. Bye-bye.